Nicotine lozenge helps people quit smoking by replacing the nicotine that they would normally get from cigarettes. When you stop smoking, your nicotine levels drop, which can cause withdrawal symptoms like craving tobacco, nervousness, irritability, headache, weight gain, and difficulty concentrating. Using nicotine lozenges as part of a stop smoking program can increase your chances of success when you are ready and committed to quitting. It's important to remember that quitting smoking is difficult, but it's worth it for your health. Using nicotine lozenges along with behavior change, counseling, and support can help you quit for good. Before using nicotine lozenges, make sure to carefully read the directions on the product package or the patient information leaflet provided by your pharmacist. When using the lozenge, avoid eating or drinking anything for 15 minutes before and while the lozenge is in your mouth. To start using this medication, begin on your quit day and suck on a lozenge when you feel the urge to smoke. Let the lozenge slowly dissolve in your mouth over 20 to 30 minutes, and try not to swallow it. During the first 6 weeks, use one lozenge every 1 to 2 hours, but do not use more than 9 lozenges a day. It's important to find the right dose that decreases the urge to smoke without causing side effects from too much nicotine. Your doctor will help you adjust your dose based on your smoking history and medical condition. Do not use more than one lozenge at a time or continuously use one lozenge right after another. The maximum daily dosage is 20 lozenges. Once you have stopped smoking and found the best dose for you, continue at that dose. After about 6 weeks, start using fewer lozenges each day until you no longer need nicotine replacement. It's important to complete the 12-week treatment period, and if you still feel the need to use this medication after that, talk to your doctor. If you suddenly stop using the medication, you may experience withdrawal symptoms. If this happens, your doctor may lower your dose slowly to help prevent withdrawal. It's also important to remember that many people are not successful the first time they try to quit, so don't be discouraged if that happens to you. Some common side effects of nicotine lozenge include mouth sores, hiccups, nausea, sore throat, headache, heartburn, or dizziness. If any of these effects persist or worsen, it's important to stop using the medication and consult your doctor. When you stop smoking, you may experience nicotine withdrawal symptoms such as dizziness, anxiety, depression, or trouble sleeping. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. However, it's important to note that serious side effects are more likely if you continue to smoke while using this product. If you experience severe dizziness, mood changes, numbness/tingling in hands/feet, or swelling hands/ankles/feet, it's important to stop using the medication and seek medical help. Additionally, seek medical help immediately if you experience chest pain, confusion, severe headache, fast/irregular/pounding heartbeat, trouble speaking, or weakness on one side of the body. While rare, a serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using nicotine lozenges, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a medical history of certain conditions such as blood vessel disease, diabetes, heart disease, high blood pressure, liver or kidney disease, or thyroid problems. It's also important to note that nicotine lozenges may contain aspartame, so if you have a condition that requires you to limit or avoid aspartame in your diet, be sure to talk to your doctor or pharmacist before using this medication. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using nicotine lozenges with your doctor. Nicotine from smoking and from this medication can pass into breast milk and may have undesirable effects on a nursing infant. If you are pregnant, it's best to try to stop smoking without using a nicotine replacement product if possible. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. As you start using nicotine lozenges, it's important to be aware of how they may interact with other medications you may be taking. Nicotine lozenges can affect the way your body processes certain drugs, so it's crucial to inform your doctor and pharmacist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. Additionally, quitting smoking can also impact how your liver metabolizes certain medications. It's important to inform all your healthcare providers that you are in the process of quitting smoking, as this can affect the effectiveness of drugs such as acetaminophen, caffeine, insulin, oxazepam, and others. Always consult your healthcare providers before making any changes to your medication regimen. If you suspect an overdose and the person has serious symptoms like passing out or difficulty breathing, call 911. Otherwise, contact your local poison control center immediately. In the US, you can call 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include confusion, drooling, seizure, slow or shallow breathing, and hearing problems. This medication is not recommended for use in children. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. If you are using this medication regularly and you miss a dose, take it as soon as you remember. If it is near the time of your next dose, skip the missed dose and take your next dose at the regular time. Do not double the dose to catch up. When using the nicotine lozenge, it is important to store it at room temperature, away from light and moisture. It should not be stored in the bathroom. If you have a partly used lozenge, wrap it in paper and discard it in the trash away from children and pets. It's important to keep all medications away from children and pets. When the nicotine lozenge is expired or no longer needed, it should be properly discarded. It is best to consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.